Okay, thank you for introducing me. Hello everyone. My name is Jung Kim from Yonsei University of South Korea. It is my great honor to be here and to present my research about mental disorder among people with HIV in South Korea. And I think this session is good example of a mixed method session because mainly presented about qualitative aspects of burden of mental health disorder. And I would say the quantitative aspect of the burden of mental disorder. This study was supported by Korean CDC. And first, as you all know, the mental health is more prevalent in people with HIV than in general population, including depression, anxiety, and cognitive disorder. Several previous studies have shown that up to 50 people with HIV experience depression, and many also suffer from anxiety and other mood disorders. These mental disorders can influence the progression of HIV and its outcomes. For example, depression has been associated with low adherence to ART, and it can also reduce the effectiveness of the immune system and making individuals more susceptible to opportunistic infections. Therefore, it is crucial to recognize and address the intersection of HIV and mental health. In Korea, a related previous study was published in 2015. This study was using data from prospectively enrolled cohort and included 840 people with HIV from 2006 to 2012. This study focused on anxiety and depressive symptoms, which are evaluated by survey. According to the study, the prevalence of anxiety was about 32% and the prevalence of depression was about 36%. Although the study included a relatively large number of people with HIV, it has some limitations. First, because this is a registration cohort, the most people with HIV who did not enroll the cohort was not evaluated, and because it is a registration cohort study, it may not represent all people with HIV in Korea. And lastly, because this is a cross-sectional study, the trend of mental disorder cannot be evaluated. So until now, there have been no reported studies analyzing the prevalence of an instance and trend of mental disorders among people with HIV on a nationwide population basis. In Korea, the nationwide claims data can be used for research, so we aim to identify through this database the prevalence and instance of mental disorders, trend of mental disorders according to time after HIV diagnosis, and whether there are differences exist by sex among people with HIV. We used data from National Health Insurance Service database of Korea spanning from 2002 to 2021. The study populations are all people with HIV in Korea, and people with HIV in Korea are defined by receiving V103 claim code more than twice. The V103 code is a unique code for HIV infection in Korea. In Korea, people with HIV can be supported by their medical expenses by government, and the people who receive the V103 code can be received fund budget from government. So nearly all people with HIV in Korea receive the V103 code for their medical reimbursement. So the reliability of this operational definition believed to be high, and additionally, we compare the number of our definition with the actual reported number of people with HIV in Korea and confirmed its validity. The study outcomes are mental disorders of people with HIV, And these mental disorders defined also by receiving diagnosis code of mental disorders referring to previous studies. And the diagnosis of mental disorder was established only individuals visited outpatient clinic more than twice a year or hospitalized more than once a year. Now move on to results section. During the study period, a total of 18,073 people with HIV received V103 code. Among them, we excluded some people with HIV who corresponded to the washout period to exclude those who diagnosed with existing mental disorders. Finally, 17,000 people with HIV included in our analysis, and among them, more than half of people with HIV diagnosed with at least one mental health disorder. You can see the prevalence of individual mental disorders. First of all, the prevalence of mental disorders are higher in women than in men people with HIV. The prevalence of mental disorder in women was about 61%, and in men was about 51%. And you can see that the anxiety and stress-related disorder had the highest prevalence both in women and men, followed by mood disorder without psychotic symptoms. We also investigated the incidence of mental disorders. And overall, the instance of overall mental health disorder was per 100 person year was 4.4, and the pattern of instance of mental disorders are similar to the prevalence, the pattern of prevalence. You can see that the instance of anxiety and stress-related disorder was highest in both men and women, followed by mood disorder without psychotic symptoms. We also investigated people with HIV who had multiple mental disorders. Among people with HIV who had mental disorder, more than 70% had 2 or more mental disorders, and more than 40% had 3 or mental disorders. Among people with HIV who had mental disorders, those who had 2 mental disorders were the highest at about 32%. And among those who had 2 mental disorders, those with anxiety and stress-related disorders and mood disorders without psychotic symptoms were high at 15.5%. Now, we also investigated cumulative instance of mental disorders according to time after HIV diagnosis. First, you can see the red line and you can see the blue line. Red line means the woman and blue line means the man. So the cumulative instances of mental disorders are higher in women than in men, people with HIV, and the differences were statistically significant. And also you can see that even after several years have passed after HIV diagnosis, the instance of mental disorder increases relatively steadily. Now, the conclusion. The prevalence of any mental health disorder among people with HIV in Korea is more than half. The prevalence and instances of mental disorders are higher in women than in men. The most common diagnoses of mental disorders are anxiety and stress-related disorder, followed by mood disorder. Among people with HIV who had mental disorders, 73.5% had 2 or more mental disorders, and more than 40% had 3 or more mental health disorders. Even after several years have passed after HIV diagnosis, the instance of mental disorders increases relatively steadily. Thank you very much for your attention.
you.